Alors, la conférence de presse se déroulera ainsi. Le ministre de la Santé, M. Dubé, s'adressera d'abord à vous. Ensuite aura lieu une période de questions des médias à laquelle le directeur national de la santé publique, Dr. Horacio Arruda, se rendra disponible pour répondre aux questions. Alors, sans plus tarder, M. Dubé.
Alors, merci beaucoup, Marjorie. Alors, bonjour tout le monde. Bonjour, Dr. Arruda. Aujourd'hui, c'est beaucoup de bonnes nouvelles. Alors, commençons, entre autres, par la vaccination. On est très, très, très heureux du déroulement de la vaccination. Comme vous savez, on a débuté la prise de rendez-vous de nos 85 ans.
I can't hear a thing, that's why.
Environ, plus de 70 000 rendez-vous qui avaient été pris sur notre plateforme. Donc, puis le travail de prise de rendez-vous se déroule. J'aurai une mise à jour un petit peu plus tard. Mais on est aussi très heureux d'une nouvelle qu'on a eue ce matin. Vous savez,
this morning, you know, we had some doubts about Moderna in the month of March. So not only Pfizer has confirmed that we would get 400,000 doses in March, but we will get 300,000 for Moderna, which means that within the next 4 weeks, we'll get 700,000 doses by the end of March. So this is excellent news, according to me. And I confirm this to you because I know that the question was often raised. The second dose will be provided by March the 15th, as planned. So, great news again. I would like to come back to a few things. All regions outside of the greater Montreal region have started the vaccination. As for the 85-year-old and over, this might have been created lack of clarity, confusion, and so this starts on Monday in Montreal. People are making appointments today, but the greater Montreal region vaccinations start later, and other great regions also. I want to explain things because a few questions have been asked this morning, great questions. Why is it, for example, that we have in certain regions different dates? But we must understand that we have deliveries for vaccine plateaus for sub-regions. For example, the Gaspésie region, the sub-region, for example, for the lower St. Lawrence region, we'll get some vaccination for a city. This will start on March the 8th. But for another city, the next week after that. So I want to clarify that. I don't want people to be concerned. Everybody will fall within the delays, and sub-regions may raise some logistics issues. We know that making an appointment for caregivers, family caregivers, has raised some issues. I'm quite transparent here in front of you. The way the survey or questionnaire was designed, this may not have been so clear for a caregiver making an appointment on behalf of someone else, should they register immediately and so on. I wanted to bring this correction today, but given the fact that this is a real-time platform, we'll make corrections tonight. And this is a problem that will be solved tomorrow morning. So this is not an issue. I just want to say that we have this little adjustment to make, and we'll do it tonight. Now, what's important here is that for all of those that registered, and I'd like to give you an example, for example, somebody that had registered a person who's 85-year-old, a caregiver who's 70 years old or more, so the appointment has to be made with a distance of 2 days. We'll check things out, but when this person comes on site, as long as the appointment has been confirmed, even 2 days later, we'll spend that time together, because what's important is that we need to reserve the vaccine. I'm repeating this. This will be clarified tonight. Now, regarding some small issues, I'd like to be transparent here, but these are small details again. About the phone lines, I was concerned by that yesterday, and I tweeted this morning. I said, go to the web online as opposed to using the hotlines or the phone lines. What happened is that we had clogging during the first hour, second hour. This was overwhelmed. It's not about the number of receptionists. It's a bandwidth issue. We have one of the providers that couldn't adjust things regarding the strong demand on the bandwidth. People were calling, and one of the two providers for the bandwidth, and because of that, it seemed that it was busy, but we couldn't even get through. People could not get through on the line. So I've talked with people regarding this item. There's the labor department that takes care also of the platform. And so I've talked to them regarding all the services provided via the phone. All these adjustments are underway. It's just a matter of hours. We'll adjust things. What I would ask again. It's the first time, I'm asking Quebecers to give us a hand. If you're not 85 years old, don't call immediately. This is my request to you. We must act in solidarity. Through our actions, we must give preferred treatment to those who are 85 years old and over. 12.5%, these are for the appointments per second. I mean, the platform's there, but the rate is 12.5%. Again, this is a Quebec site. Click Santé, Click Health is a Quebec site, and we've delivered the goods, besides those glitches that I mentioned earlier. We're quite satisfied about this day, and I'm repeating this. This is our practice. We'll provide an accommodation for 12 million appointments, and we had 70, 60 this morning. I mean, this is great practice for our first morning. We're extremely happy about it. And I believe that regarding the changes that we'll have to make, we'll make adjustments real time. And I just want to say one thing. Do not hesitate. Please write. We are following up on this situation very closely. We're monitoring this very, very closely. If we have any adjustments to make, we'll make them real time if needs be. As I have just said, because I think it's important for us to make some progress, we should not wait for things to be perfect. We need to be there when we must act, and we will be there. Now, what can I say now? What may I add here that's significant? Now, well, I was wondering why, well, my next topic, variants. Okay, maybe I wanted to say something. It's sad to go from vaccination and then deal about the variant issue. We have to be sincere here and candid. I was talking with the Premier and with Dr. Arruda this morning at 11 o'clock. We had an update process we do. We have 170 presumptive cases, more cases, presumptive cases than yesterday. So this situation, and I'm repeating this, we're following up on this very closely. We're monitoring this. These are not confirmed variant cases. Again, we had to do some screening and we'll wait for sequencing to get the results. But I'd like to reassure the population, and we'll give you details about that, and we'll update people with the Premier and Dr. Arruda. And so this is what we want to monitor, the speed for being able to monitor the variants, because we've seen the cases. Again, we've seen cases drop for coronavirus. Conventional cases went down. There's a drop, but there's a slight increase at the same time on the variant side of things. Now, up to now, I think this is our summary for today. The total of both remains at 800. We had 800, 900 cases. It drops, but if variants increase, we have to look at the total sum of both and see how things progress. And so we were able to remain within the 800 plateau, as we call it. We'll follow up things, and with more than 172 cases since yesterday. I mean, we'll give you an update. We'll provide you an update with Mr. Arruda and his analyses. This is for the variant. I'd like to come back on the measures that will be implemented on February the 26th. I believe it's important to go back on and talk about a positive note here. There are some adjustments, accommodations that will be implemented tomorrow. We had announced those, for example, for March break, la semaine de relâche, pools, cinemas, theaters, and so on. This is for February the 26th. Everything will be available. But what the Premier has asked a lot, Dr. Arruda has been repeating, like the Premier, I mean, please follow the guidelines. Respect the sanitary guidelines, because when we see the risks linked with a variant and March break, I don't want us to go backwards in the upcoming weeks. Yes, we're have some easing. We're lifting things in view of February the 26th. Yes, of course, but please follow guidelines. Gatherings in homes, in residences, in cottages, and so on. This is forbidden. I believe it's important for us to do the right thing and to act in the right way so as to have a positive situation after March break. Another great news that I want to say, I really want to address positive news today. We've signed, no longer than today, an MOU with our pharmacists. So the agreement has been signed, and I told you this is something that needed to be completed and signed. And the Treasury Board has found the right way to have the pharmacists join forces with us, and we had an MOU that was made, and many companies can come in and help us for summer. Pharmacists will intervene sooner than that. We had a week, and we are defining things well with our partners. How will we be able to administer 12 million doses for the summer? In the month of March, the great news is that we'll get 700 doses. These are great news, and I will say a few words in English now.
Today, we are very happy with what we've seen in the vaccination. We are starting to make appointments for our 85 years old and over. At noon, we had more than 70,000 appointments that were made on our different platforms. We're also happy with the very good news that we had this morning. We will receive 700,000 doses for the combination in March of Pfizer and Moderna. And I confirm that we will start giving the second dose no later than March 15 as planned. I also want to come back on a few points. All regions outside of Greater Montreal will begin vaccination for those age of 85 and over in the week of March the 8th. You have to understand, however, that we have also some deliveries in the sub-region. So if I take the Bas-Saint-Laurent as an example, we will have vaccination in one city in the week of March 8th, and in another city in the following week. Also, we know that making appointments for accompanying person have raised some questions this morning. We are working to improve the situation. It will be corrected tonight when the platform is down and will be corrected for tomorrow morning. But also, I want to be clear on this point. For the person that accompany the person that are 85, and if you're 70, you could not this morning take this appointment at the same time. So please take the appointment, and when you will come in our center of vaccination, we will make sure that you get the vaccination at the same time. This will be corrected as well over the weekend. And again, I just want to ask Quebecers, they've been very patient and comprehensive. We monitor those small adjustments that we need to do. Sometimes we have those quick problems, but we want to solve them very quickly, as we did this morning. So don't hesitate also to communicate with us, either by phone or by email, and we'll make appropriate and very agile confirmation. The other good news is, as I mentioned, this week we have some agreement with large companies to start preparing for the vaccination in the bulk of the summer. And we have an agreement as of this morning with the Treasury with pharmacists. So now we have the businesses and the pharmacists that will complement what we do in the network. That's another good news. So I think that on the variant side, we had an increase as of yesterday of an additional 170 cases that need to be confirmed. So that's we have a total right now of what we call presumptive cases. They need to be confirmed by sequencing. So this is something that will be taken by Dr. Arruda next week into consideration when we move on different region, colors, and other measures. But for now, we will keep monitoring those numbers and being very transparent with them. The good news is the total is not changing. We're still at roughly 800 cases per day, including those variants. So far, so good, but we need to monitor that over the next few days. I think that completes the presentation, and we'll take some questions. Merci beaucoup.
Thank you. So we will now have our questions period. This is a hybrid format, so because of that, some journalists are attending through the Zoom platform. I'd like to remind you then that it's one question and one follow-up question per journalist, just one representative per media. Patrick Pelrose from the Journal de Montréal newspaper will ask the first question. Good day to both of you. Good day. I wanted to ask you, I would like to start with Mr. Dubé, also for Dr. Arruda. Regarding the public advice that we obtained last week, we were talking about easing, lifting measures after the break. We've learned, March break, we've learned that the primary students will have to wear the mask in primary school. So do you want to ease, to lift sanitary measures? Has the situation changed? What do you want to do? I'll start, Dr. Arruda, if I may. I've said this. Regarding the measures that have been announced to lift measures regarding the March break, this is ending tomorrow, the 26th. No changes there. There are no changes. Dr. Arruda may say a few words about that, about mask wearing for primary school students. Now, this is on March the 2nd. That's the date when we will confirm or not things about the situation. Because again, I've just given you an example. Variants change, mutate, and it's too early to tell you what we're going to do about March break. We're not changing measures, the easing, the lifting that's been announced in view of the relâche, the March break. But afterwards, we'll come back next week and then we'll have a few more days when we'll analyze the situation regarding the variants. Dr. Arruda, I may confirm what you've said. It's too early to make a decision about that. We're weighing things. We're looking at the pros and cons. Of course, the new variant is a new element pertaining to the equation for our analysis. That's why, for preventive measures in the context of the arrival of the new variants, that's why we recommend that for primary school students, so that they wear an intervention mask, a lighter mask that protects more in the context of the new variants, because they're more transmissible. Much more so in a school setting or elsewhere. As is the case for the epidemiological profile, it has changed. We had a lot of them, those cases in secondary school, less in primary schools. So because of that, we will recommend the intervention mask. The people wear that mask. This will be distributed in Montreal and also and around Montreal and also for other regions in the upcoming weeks. Question. About festivals, we've heard someone say that it's possible that festivals be held this summer, but we're waiting for a recommendation from the Public Health Authority. What are the prerequisites in order to allow for holding festivals this summer, and what would be the conditions? What would be the sanitary conditions that would be envisaged then? Answer. The summer festivals, we have to think about it now. Of course, we have to foresee things, but it's too early to say much about it. One significant thing that I'd like to say is not because you've received one dose that you must loosen up things. No, this is very important. It takes at least 3 weeks. As long as we don't have a lot of people vaccinated, then we won't be able to lift measures quickly. As long as that vaccination does not happen massively. It's a proportion of vaccinated people. That's the main element that can come in and help us. At the beginning of the summer, we won't have finished our whole vaccination campaign. So we might see some distancing measures or mask-wearing measures being lifted. But, I mean, distancing, avoiding gatherings and things like that, we'll still have the same dynamics, but we'll do as we can in order to be inventive, as Quebecers can do, to have a summer, as we say. And this will depend on the numbers regarding the pandemic. Will we face a new wave, or will we have numbers similar to those we had last year? We'll follow this we'll monitor this closely, and we'll be working with organizations that obviously want to give some hope, organizations that want to make sure that Quebecers can be happier. Question from Hugo Lavallée, Radio-Canada.
Oui. Oui, bonjour.
Yes, hello, do you hear me? Yes. Very good. This is a question about mask wearing in schools. You're concerned by the situation from what we can understand in schools. In the light of this new fact, this new analysis, the presence of variants, namely, is it not then a good thing to review the priorities, vaccination priority, for example, administering vaccines to the teaching staff? The idea was prevalent. Is that something that you can consider given the fact that things evolve quickly in schools? Answer. In view of the context of the vaccine, which is quite rare right now, I must admit that the main objective is to protect people that will die, people that will be hospitalized, people that will face grave consequences due to the disease. And I believe that what's more likely is that it's going to be in the beginning phases. The rationale of our prioritization will happen then. But we must understand that in March and April, there will be more vaccines available significantly in all these groups with these different steps. All will become more normal. The vaccine does not prevent or protect against transmission. It can decrease complications. That's very important. The vaccine can decrease things in terms of mortality rates. Unless data change in the literature, our intent is not to change our game plan in order to prevent, for example, outbreaks in schools. But most importantly, the impact is significant in schools, but children are at a lower risk. And also healthy teachers compared with other people within the Quebec society. Question for Mr. Dubé. We've heard you speak about the measures that will be implemented tomorrow. Some lifting of the measures in view of the break, la relâche, the March break. You're confirming that the measures will still be valid, but you had some concerns or some things are being lifted. Have we reached the limit? Are you moving because we have entered in the March break phase? Answer. Tomorrow's the 26th. My answer is no. People needed some lifting of the measures for their own morale. I gave you a feeling, an impression, but that's not at all what's happening. What I said in my statement, I said, however, people must comply with sanitary measures. We are lifting some measures, but this is a critical time. We don't know the impacts of vaccination. Variants are here. So we provided with some lifting, some easing, and so on, Mr. Lavallée, but we must comply with the sanitary measures during the March break. We've said this since the beginning. I must confirm this. These were just ways to lift measures so as to enable people to go play outdoors so that their mental health be in a better position, a better situation. That's what we said, so that people can play outside. So again, we've said this. The activities that we allowed, these are low-risk activities. If people follow the guidelines and don't come up with big gatherings indoors, as was the case during the holidays, then we can accept this risk. We can manage the risks, and the benefits will far outweigh inconvenience. But we've said this since the beginning. It's very important for the rest of guidelines to be respected. Less than 2 meters, distancing, you must wash your hands, mask wearing, avoid non-essential contacts. Again, question from Claudie Côté, TVA News, TVA Nouvelle. Good day, gentlemen. I would like to hear something about priorities for vaccination. What about people who have an immunosuppressed condition? They might be mostly vulnerable because of their health condition, but they're not part of the older group, 85 years old and over, or 90 years old and over. What about the staff working in clinics? They don't work in hospitals. They have not received a vaccine, even though they're in contact with some vulnerable people. The nurses working in clinics, for example. Answer. I understand why people are concerned. This priority occurred in the context when the vaccine is rare. We have to go where we find the greatest benefit. Of course, benefit can be found in several places, but we must correct things. Of course, the age is the most determining independent factor. The Premier has mentioned this on a regular basis. For hospitalized people, they died, and this corresponds to some age cohorts. Now, immunoconditions and cancer treatments and so on, those things are true, but it's age that's the most important factor. Within the age factor, there are people that are at a higher risk. We're adding these people. We're taking into consideration all those elements pertaining to this rationale. So for health workers, this was analyzed in view of the different risks that our experts have identified in these environments. But the great news is that we're coming out of a very dry vaccination period, I hope. there was some scarcity. Now we can start up the machine. And again, we have different cohorts and groups with some distancing somehow. Now these things will be brought closer somehow. These different groups will be brought closer. It's not because we wanted to prioritize these groups, saying that one group's better than the other. No, it's just in terms of prioritization. This doesn't change anything, but the new thing will be vaccination. And so I would like to invite people, if you're part of one group and those groups and you haven't been vaccinated, do it. Some people hesitated at first. The solution is the vaccination. Question? The surgical mask, the mandatory mask wearing consideration. You've talked about some complications, maybe not so many complications for the youth. Has this changed? I mean, do we have new data? Do you know everything about that situation? Can you say something about it? Answer. The new variant is the key component in the equation. I've said this before. We've asked our National Public Health Institute for their recommendations. Our recommendations come from our own experts, from international experts, and the international experience. Now, mask wearing in schools, we don't have a unanimous position on that everywhere, but there's a new variant. And because of that, and also because before Christmas and after Christmas, we realized that in primary schools there was a significant transmission in those settings. There are new variants circulating in Quebec, and for preventive reasons, we believe that the benefits of wearing a lighter mask, I mean, these masks will be pediatric masks for children, pediatric masks. This is important for preventive measures to protect them, the teachers, the workers, the staff, and the community. This adds on. Smaller than that, as we say, there are few negative impacts in terms of social relationships and learnings and so on. But for a certain time, which will be shorter than a full school year, I think it's indicated in that context. Those are the recommendations we received, and the Education Department will enforce things in view of our own recommendations. Question from Louis Lacroix, Cogeco Nouvelles. Mr. Lacroix from Cogeco. Do you hear me well? Yes, we hear you well, Mr. Lacroix. Is it possible? I would like to have more information about the new variants. How many outbreaks do we have in schools regarding the new variant? Where are they? These presumed cases of new variants. Where are the outbreaks? Answer. Should you start and then I can conclude? Go ahead. We are entering into a process where we have some screening, molecular screening, and so in the Greater Montreal region and for the rest of Quebec, I think we will be able to give you the details, the data as per region in the upcoming days. It's just a matter of getting this by the beginning of next week. Currently, we have an issue, namely, we have to screen things out as quickly as possible, and we do that through our labs, and so we committed. We wanted to get 100% of the screening in the Greater Montreal region. This was done. Our challenge was to do it at the scale of the Quebec province, and so we will be able to get the breakdown as per region, by region. When we take several regions and we're only dealing with one lab, we don't have the details, all the details. Now it's a matter of days. I've been told that I wish to get all the data during our next press conference so that I'll be able to give you all the details about it. Question. There's an issue in Europe and in many countries, something that's been raised. It's about the vaccination, which is still on in several countries. This issue is about the possibility of enforcing some type of vaccine passport, not to cross borders, to go from one country to another, but, for example, to attend a show in a theater venue, for example. You need to come up with your vaccine passport to show that you've received your shot, and you can go to a restaurant because you have that passport. Is this an idea that you've envisaged or that you are envisaging in Quebec? Answer. The answer is yes. I'd like to draw a parallel with the H1N1 situation. When we wanted to have some type of authorization to take a flight, for example, you had a printed document which was your evidence, the proof that you had been vaccinated. So that's the proof of vaccination. Now, you know that I like IT a lot, and so I asked for a digital version, something that would be in a rational continuity of the Carnet Santé, the health RAMQ health board document. So we wanted to ensure that people would start up the vaccination process, that people would be vaccinated, but the digital vaccination passport, for me, this is totally normal. We have teams that are currently looking at that. Yes. We have to understand what the conditions are, why someone is considered to be not at risk. I mean, we'll have to look at the situation. It's not because yesterday you've been vaccinated that you are totally protected today. No. It doesn't mean that we will eliminate all the preventive measures that are necessary in the short term. No, we have to look at the whole situation. As our minister said it well, technology will be considered. We have a registry. We can transfer the information for the vaccinations. The greater element of complexity pertains to the very criteria. What does this mean? What will this mean? One of the dangers is that people can say, okay, I've received my shot, so this is now a free-for-all situation. It's free for everyone, and we do anything we want. No. We know that this will protect you in terms of the complication risks and so on, but it doesn't prevent transmissibility from one person to another. We've been looking at that. Technologically speaking, things will be considered. Question from François Carabin, Journal Metro newspaper. Good day, gentlemen. First of all, Mr. Dubé, I wanted to come back to the significant request about the appointments to be made in view of the vaccine this morning. You said 12.5 appointments per second. 12.5. Why do you believe that we'll be able to meet with the demand, will comply with the needs as soon as we have a greater eligibility, a greater pool of people that are eligible to receive the vaccine? Answer. Thank you for your question. What's at stake here, and we said this regarding older people, we thought about the fact that we might have a greater proportion of users referring to the phone line as opposed to going online. But I was surprised. We had a lot of registrations this morning online registrations. I was suspecting that we would get more registrations over the phone. There are no issues for the web, by the way. So when we deal with the other groups, 80-year-old, 70-year-old, and so on, will we have the same breakdown between the online and the phone line platforms? But we're surprised, really, to see how many people have made their reservation, their registration online. Now, there's the bandwidth issue. It must be solved in the next minutes. If we don't do it now, it's soon. Soon we must solve the bandwidth issue. Besides that, I don't see any issues regarding the ways we can book our appointment. We've had some technical glitches for our first day. We've talked to the providers for the bandwidth, and also more than 70,000 registrations within 24 hours. We were able to do that, so there are no issues regarding those. Follow-up. Regarding vaccination, you've seen the Canton, the Vaud County from Switzerland. They had an initiative. I may not pronounce this well, but some mobile clinics were created so that with those clinics, they vaccinated vulnerable people who couldn't travel in order to get the shot. This is some residence service. Marguerite Blais, your colleague, yesterday repeated the fact that the manufacturers made some requests, which meant that you could not go from one door to another and then knock on people's doors. So they have the same providers as Pfizer and Moderna. So I'm asking you this question: why is it not impossible? Why it's impossible, according to you? Why could we not provide this residential service and go to visit people and vaccinate them in their own home? Answer, there is a logistic matter. We have to be able to, well, I cannot give you an example about the vaccines, but there's an example in Switzerland. I can't talk about it, but yesterday in the evening, we've talked about this with Ms. Blais, notably, but also with Mr. Lionel Carman. We've entertained this. Lionel works with community organizations, and we stated, tell us about the demand you have for people who cannot go get their vaccine. So we have to rely on the information coming from the community organizations. And it's during the weekend that we can finalize those requests. We asked our CISs and CEOs in collaboration with Lionel Carman, and so if we can get closer to some sites where we can send out the logistics. I can't talk about the Switzerland model, of course. We'll look at it. But with Pfizer, there's an issue here. With Moderna, it's not as bad, but obviously, if we had AstraZeneca or other ones, well, we will find a solution. I've said this. We're looking right now. We want to know how we can get closer to these people. But again, I'm repeating this. We focused on those who are 85-year-old and over, who can move around and who can go to a clinic, to a vaccination site. But then we'll think about these things. Question from La Presse. Good afternoon to both of you. My question is about masks, surgical masks in schools. Considering that the variants, we've been talking about those for a few weeks, they're in the schools or they're around. Why have you waited until next week to enforce them and so on? Is it because there's an availability of masks issue? Answer, there's always a logistics issue. Whether we have a variant or not, we've enforced some measures. This is an additional preventive measure that we're adding on top of the measures that exist right now. So I believe that this is really, there's a new variant, and in secondary schools, we had some cases. And with procedural masks, we proceeded, In primary schools, this was not so much an issue, but sometimes it's more complicated to wear a mask if you're a little kid, a little child. But given the advice from our experts, we decided to greenlight this and go forward. Follow-up, McGill University has announced its plans in view of next fall. Laval University also, you've talked about the summer. Is it premature right now to start planning already in view of this fall regarding the higher learning institutions? Answer, planning is always good. We cannot wait till the last minute to do planning, but final decisions will depend on what we observe. Regarding vaccination, this is a different game. This is a game changer because the likelihood for positive things is greater than the likelihood of having negative situations. We need to plan for this. This is great news, of course. We have to remain positive, but decisions will be made depending on the epidemiological situation that we will observe. Last French question, Mylène Crête from Le Devoir newspaper.
Bonjour.
Good day. Good afternoon. I wanted to know the vaccination or vaccine passport. I'm curious about that. Based on what you said, I'm curious. What do you envisage? Is that a passport that would show that somebody has received the 2 vaccine doses, which would enable this person to have access to certain settings or venues when we lift the sanitary measures or before? Answer, indeed, when I book my flight, if I want to fly somewhere, I can use a QR code and then, my boarding pass, the square QR code. And this is a simple parallel that I'm drawing with the H1N1 situation. Remember, a few years ago, you received by email a document. You could print this using your own printer, and you had an evidence, a paper evidence or document that proved that you had been vaccinated. Let's simplify things now. This well-known QR code, you know how to recognize it easily. You can place your phone over it, and then immediately it creates some type of hyperlink or web link, and that's the goal. And given the fact that currently we are in a digitalization process at the state level, Erika, my colleague, is creating that and other solutions. In view of all that, it's very likely for me to think that eventually we'll get a short-term vaccine passport. That's what we've envisaged. And as Dr. Arruda was saying, the idea is, when should you get the passport? After so many weeks of after the vaccination or not? We don't know when exactly to actually provide the passport. We're analyzing that. Follow-up question. What does that mean? Does it mean that the lockdown sanitary measures will be lifted faster, or as opposed to a situation when we wouldn't get the passport? What's the role of the vaccine in view of the lockdown or sanitary measures? Answer. All these sanitary measures are important. This is a tool, this is one measure, but we have to enforce it or implement it, and we have to make sure that it's practical. We are envisaging that for sure. We will have some English questions now. There are some English-speaking journalists right now attending in the room, so we'll proceed with them first. Just mention the name of your media and then come up with your follow-up question.
The question is for Dr. Arruda. What are the details of your recommendation to wear masks in schools? So what type of masks, what grades, all the details, and why did you decide this?
Okay, there is a new, I would say, thing in the equation of the disease, actually, in Quebec, is the new variants which are more transmissible, which have been associated in the big transmission in youths too and adults too. So in that perspective, we had asked for our institute to look at what are the recommendations that they can make with this new variants, and the use of, I would say, intervention masks, which is the medical ones, the ones in paper, which are a little bit, I would say, lighter, would be great for kids in schools from grade 1 to grade 6, as it's already for the secondary schools. We observed before Christmas and the fall was more the high schools who have big outbreaks, less in smaller schools. Now, before Christmas and after in January, there was outbreaks in small schools, so it's why we use that new recommendation for the preventive aspect and lowering the risk of outbreaks.
Perfect, thank you. And my second question is for Minister Dubé. How busy are the phone lines and how are online reservations going with the vaccination appointments?
Yeah, I'll give you the stats at 12 because this is roughly at the time I left the office, and I'm checking if I have any updates in the next few minutes. I didn't get any update, no, not yet. But we were, as I said, we had at 12 72,000 appointments that were made this morning within 4 hours. The waiting time was below 20 minutes on our phone lines, okay, which is still too high to me, but that's the good news is there were a lot of people on the phone, and we understand because with the category of people that we have today, we had an issue with what we call the bandwidth, because one of the supplier was not able to upgrade as quickly enough the bandwidth for those lines. They told us that would be solved this afternoon. So my objective over the next few hours is we have now no issue on the website, so people are able to, most of the appointments have been done on the website, and I think we'll see in the coming days a very small time of waiting time on the phone, so I think we're there.
Thank you.
Merci pour excusez-moi, c'est vraiment une question, une sous-question. Pour le prochain média anglophone?
Kelly Gregg from CTV.
Hello.
Hello. For Mr. Dubé, it's a bit of a, just want to confirm the first part, but also ask kind of a sub-question within it. Is Laval the first mass vaccination site? And if so, why Laval is going ahead and not other regions?
What do you say, the first?
The first mass vaccination site where people are, where the 85-year-olds are going, because it started in Laval today at noon. So is it the first?
Is it the first? I'm not sure. I think that some vaccination took place. That's a good question. I don't know if Laval was the first one, but I can check that.
Okay, so why does Laval get to go ahead today, for instance, whereas if you live in Montreal, say, you have to wait till Monday to get
You mean
vaccinated?
for 85 and over?
Yes.
Oh, I see. Well, I think Laval, and by the way, Quebec was a bit enthusiastic too. I understood. So I think that people made the decision. I think it has to do in Laval. And I'll check that because maybe I can just send you an SMS. But I think Laval, they are testing exactly what I was talking about before with how do we say soins à domicile?
Home care?
Home care. Remember, because we said, how can we, without moving the vaccine, which we cannot do right now, what can you do to test the home care? And I think that's what they are doing right now. So maybe that's the reason they decide to go 85 and over today. But let me check that because I'm not sure.
Okay, I'll wait for your text.
Yeah.
And
I think Marjorie has your line.
I think so.
Yeah.
I bug you guys enough. And just this idea of a vaccination passport, what would be the goal of that?
I probably went too far today on that, but anyway. The goal is easy. I think there's two ways. We want to be, I think it's a good thing for people to be vaccinated. That's first. And I think people, the way we see enthusiasm about people wanted to be vaccinated, they want sometimes to have the proof for that. And I think it's normal. I think I heard many enterprises that said they would like to be able the first to open their doors if they had a proof that the people inside can have a proof of vaccination. So we're saying, I mean, we are in a digital world, and I don't see why we could not have, as I mentioned earlier, what we call the QR code, that we have on our boarding pass when we fly. So I think it's just normal that we go there. So in preparation for that, because we're not there yet, but I think in preparation for that, we ask our IT people, but also on public health, what are the conditions that we could have to make sure that when you're being issued a QR code, you're really vaccinated, and that can be quite helpful. I don't know if...
Mostly the word passeport santé is for passport. It's used especially, I would say mainly, to people who want to travel and make a proof, because on the other side, in the other country, they can ask you, have you been vaccinated? And I think that's almost I would say the preoccupation. It's also a way for a person to be aware of have been vaccinated, and then using it in the community. It will depend on the impacts of the epidemiology, and we will follow what are the best practice in the world in that field. But I would say the first will be for traveling needs, because some countries will ask for having a proof.
Thank you.
Nous allons maintenant passer.
We will now answer from the Zoom platform in English for the last segment, and the first question will be from Journal La Gazette newspaper, using the Zoom platform.
Monsieur Autier, on vous entend pas.
Sir, we don't hear you.
Sinon,
If not, then we can also give the floor to Lauren McKellum from CBC News. Good day. You can hear me? Yes.
Dig up my questions here. So first of all, you mentioned there's an agreement that has been reached with pharmacists as well as some businesses, if I'm not mistaken.
Yep.
Can you explain how that will work when it comes to vaccinations? Does this mean it will speed up the process?
Yeah, well, I'll start with pharmacists. Pharmacists, this is not different to what we did last fall. Remember, we had an agreement with pharmacists. We did over 1.5 million vaccination through the fall, and the pharmacist has done probably half of those. So I think it has been a very good contribution of them last fall, and we just renewed this agreement for this program. So that's good news. With businesses, what we, with my colleague Pierre Fitzgibbon, what we've asked the businesses, and we had a very good reaction from them. We asked them three things. We said that during the summer, and I think I've mentioned that many times, we will have to vaccinate within a very small period, whatever that period is, 12, 15, or 20 weeks. Hopefully it's 20 weeks if we receive big doses before, but say within 12 to 20 weeks, we will have to provide to Quebecers about 12 million doses because we have 2 doses for over 6 million Quebecers that want to be vaccinated. So what we've asked the businesses, and they are very interested in doing so, is not only to help us vaccinate their employees. You can think about large corporations that have 1,000, 2,000, 3,000 employees and over that in Quebec, but also at the same time, if they make the logistic of having a location, we can vaccinate at that location not only the employees, but we can vaccinate the family of those employees, and in certain region, vaccinate the population around. So what we've asked those businesses, and we have been in link with 4 associations of those different businesses, manufacturers, exporters, etc. And they said, we will provide you lists. We have received in this last few days so many names of businesses that want to do business with us, sharing this sum of partnership so that we can share this 12 million doses being vaccinated over this summer period. So that's good news, and we are now dealing with the details. How many people do we need to train? Because we have within our network more than 3,000 vaccinators. If we want to go at that level, we need to add 1,000, 2,000 vaccinators that could be in businesses. So we need to have the name of those businesses, how many they can do, and how many vaccinators they need. So this is something that we aim to be starting in the spring. So I think this is good news, and people are proud, businesses are proud to come and help us in this process of this big program that we have.
Thank you. My second question is, we're maybe not there yet, but I'm looking at the priority list, and after the 60 and up people, there is another group, and those are people who are at high risk, right? So what will people under 60 years old have to show to prove that they are high risk? Will they have to make doctor's appointments? Will they need a note? Can you explain how you will judge who is at high risk?
First of all, I think we will not ask to have access to the medical dossier of the person, but we will be asking some questions. We will explicitly communicate what it means, diabetes, if you are heart failure, chronic disease, all those information is going to be made, and we will, I would say, it's going to be in trust with the people, and when the people is going to take their I would say their appointment, there's going to be some questions about this. And I think that at that period, with a lot vaccine, it's going to be easier to do that. And we really think that Québécois are going to respect those things, and I think it's okay.
Alors maintenant pour la dernière.
So for the last questions, we will have a second attempt, Filote, from the Gazette. You have the floor.
Good afternoon.
Bonjour.
We're just wondering, how concerned are you about the effects of March break? You are hinting that some things were not, some easing that seemed to be possible would not happen. How concerned are you about it, especially after what happened in the last March break?
Well, I think the only comparison that we can do, I think, not only with the March break of a year ago, but with what we had in the holiday season 3 months ago, people have said clearly, and we have done questioning about that people a portion of the population didn't respect the rules, and they have been vocal about it. So what we're saying is it's the same risk. And you've seen what happened in January after the Christmas break. You saw the cases going pretty high. And I remember, just remember that in January, we had 1,500 people in hospitals. And at that point, we were saying, what do we do next? Because at 1,500, we were there. So I'm just saying that we don't want the same thing to happen in the March break. We've said clearly that there are some rules that need to be respected. And I hope, and that's the reason I repeat that today, March break start this weekend. Let's make sure that we follow the rules because we are 1 month away from having a very high number of vaccines, and I think we should benefit from that. So let's be prudent. That's the point today.
There's also, Mr. Dubé, a tweet that Mr. Denis Coderre has posted that he was having trouble getting an appointment for members of his family, and he called your office,
yeah,
and it was straightened out. So on Twitter, people are saying it's favoritism.
You should see the number of calls that I have received this morning asking questions. What we told them, and I'll told everybody that is either sending me a text or at my staff, this is the way you should do it, and there was no there's no favoritism at all. I think the only thing you can tell us is we're being agile and we answer a question very quickly. So if there are changes to be done, we will do them, and for anybody that will ask those changes.
Merci, c'est ce qui met fin au point de presse.
Thank you. And this ends our press conference today. Thank you. Thank you, everyone.